Welcome to Beyond Bite Wings, the business side of dentistry, brought to you by Edwards & Associates PC. Join us as we discuss how to build your dental practice, optimize your income, and plan for your future. This podcast is distributed with the understanding that Edwards & Associates PC is not rendering legal, accounting, or professional advice. Listeners should consult with their business advisors before acting on any of the information that is shared. At Edwards & Associates PC, our business is the business of dentistry. For help or more information, visit our website at eandassociates.com. Hello and welcome to another episode of Beyond Bite Wings. My name is Ash, and today we will be talking about dentistry, risk, and the law, protecting your practice before problems arise. And to talk further on the subject matter, we have a very special guest. His name is Dr. Jordan Romano. Without further ado, Dr. Romano, how are we doing today?
I'm doing great. Thanks for having me.
Oh, of course. So for our listeners out there, can you tell a little bit about yourself and also what you do?
Sure. My name's Dr. Jordan Romano. I'm a hospitalist, so I'm internal medicine board certified, and I practice medicine inside the hospital. I take care of hospitalized patients. I did my residency training at Dartmouth in New Hampshire. I had been at Mass General and Harvard subsequently for 14 years, and I now practice still in Boston at Tufts Medical Center. During that time, for just over a decade now, coming up, I think, on about 12 years, I've been a medical expert witness. And I founded a company called medicalexpertwitness.com, where we help expert witnesses meet attorneys and attorneys meet expert witnesses. It's a way of marketing, but also doing practice management and sort of nuts and bolts assistance and administrative tasks so that clinicians can be clinicians. Because the vast majority of expert witnesses, when they do this, it is something they do on the side. The vast majority of individuals, including myself, are clinicians first, and they don't really have the bandwidth to amplify their presence in this space. And so that's why I founded medicalexpertwitness.com.
I see. Now, for our listeners out there that are a little familiar with the legal process, what exactly does an expert witness do in malpractice or professional liability cases?
Great question. So the legal system leans on expert witnesses to describe essentially what's called the standard of care. And legal, it varies jurisdiction to jurisdiction, state to state. There are, similar but slightly different laws, but expert witnesses come in to review medical records and to look at the scenario. There's a lawsuit that's filed, so something untoward happened. The real question is, did the providers involved, this is generally speaking, the providers involved, did they do something they shouldn't have, or should they have done something and didn't? That's generally the tenor of what's happening. So an expert witness will come in to say, was the standard of care met? And the standard of care from a legal sense, generally speaking, and this tends to hold across jurisdictions, which is the standard of care is what an individual with same or similar training would have done or should have done in same or similar circumstances. So you're called in as an expert to look at the medical records, and eventually, if they're sworn statements, to look at the deposition testimony of the other experts or the individuals involved and hear their side of it and put yourself in those shoes at that time and say to yourself, did this provider do what any reasonable clinician would have done in same or similar circumstances in the same situation? And so the vast majority of what you're going to do is read records and communicate with the attorneys, whether that's the plaintiff side who represents the aggrieved or the family of the individual that something untoward happened to, or it's the defense and you are looking at it from the side of the providers and saying, yeah, they did everything they were supposed to do. If you take that view when you look at the records. So you're retained typically by one side or the other. And listen, there are plenty of times where you read those initial records and you're like, sorry, I know you're trying to defend this individual, but it's my take that he actually or she actually breached the standard of care. That can actually be informative as well, because the individual, whether it's plaintiff or defense, if they're hearing that you're not supportive of the care, they may not proceed with that case, or from the defense side, they may settle it sooner. And so it's very important for providers to, and this is a space, I will tell you, historically, it's not something that people talked about on podcasts. So first of all, thanks for allowing me to do this. A lot of this expert witnessing has kind of been historically in the shadows. But since the pandemic, I would say in the last 5-7 years, more and more clinicians are learning about this and coming into it and really understanding how important it is to participate in the process.
Now, speaking of standard of care, how does it differ from what a dentist may think best practice?
Well, it's all applicable to your practice. So it would be obviously, there's different subspecialties in dentistry, and it's the same thing. What a reasonable dentist would have done in same or similar circumstances, with same or similar information, right? So are they practicing the way a normal dentist would practice? It's basically identical to the other medical specialties.
Okay, that makes sense. Now, Dr. Romano, most dentists don't think about the legal risk until, let's be honest, something goes wrong. From your perspective as a medical expert witness, why is it critical for dental professionals to think proactively about legal exposure?
Well, there's probably things that are happening now, in medicine and healthcare, we call them near misses, that are happening where you may or may not alter your practice or your workflow or your procedures and protocols to make sure those situations don't happen again. But one of the reasons that early on in the 12 years I've been an expert witness, one of the things I realized early on was, wow, this is going to make me a better doctor, because it's only a minority of my free time, but I'm using some of my time to read situations that went sideways in healthcare, right? Where bad things happened. And we're not talking about the in air quotes, is there anybody at fault? But just by reading untoward scenarios, it helps make you a better clinician. So for the dentists that are listening, if you thought about expert witnessing, first of all, I think it's important to uphold your own standard of care in your profession. So it's important to participate in medical legal affairs. It's not everybody's cut out for it. Not everybody has the time for it. But if you're thinking of doing it, I certainly would try to start with one case, because when you're reading about things that didn't go well, you can go back to your own practice or your own place of, if you don't own your own practice, if your place of work, and just really scrutinize yourself to make sure you're doing things and handling things in a way that is making sure that the best care is given to your patient. So without a doubt, it makes me a better clinician. And so I think that would also apply to all of your listeners.
That makes sense. Yeah. Being critical of yourself and seeing yourself under that light would help you to see maybe some of the pitfalls and improve upon it proactively, as opposed to waiting to react.
And by the way, there's a lot of things that are likely happening that you're like, well, I did everything I needed to do. For instance, let's say you put a plan in place that one of your patients needs to follow up with another specialist, a oral maxillofacial surgeon, right? Like maybe they need a biopsy for something, or they're watching something, and you're like, okay, you need to go to this person and follow up every 6 months. Now, I don't know what this is a completely hypothetical situation, but one of the things that can happen is, and I'll do air quotes again for your listeners, but people get lost to follow up. And that is a category of cases of like, well, you made the recommendation. Did you make the consult? How deep did you go into making the consult? Did you call the consult for the patient and they failed to reschedule? Did you send them an automated text and you don't actually know if they received it? And so I think that when you start looking at, reviewing cases where are you actually providing the best care? You might be doing what's expedient and you might be doing what's most efficient. And there's definitely a focus in that in this day and age to like, okay, how can we see more patients so that, we reduce the wait times and we are able to diagnose and treat people in a more expeditious fashion, but it's also at what cost, right? Are you leaning too heavily on technology? And there might be patients who, for instance, are are not receiving the care they need because they're not interacting with the technology the way you think they would. And so I think that that's an interesting piece of this as well. The saying is what, if a tree falls in the wood, does anybody hear it, right? So did you truly do your duty? And there are cases like this. Did you do your duty because you sent a text message follow-up? Okay, like, is that communicating? That can be debated. And so I would say it's not only what you do when you're physically there with the patient, but it's also and it's just one category of where things can go sideways. It's after the patient leaves. How are you ensuring that your plan is unfolding, right? Maybe you sent somebody to a consultant. That consultant had a plan and said, okay, follow up with your primary dentist in X amount of time. Were you CC'd on that communication? Did your office miss that CC in that communication? And then the patient gets lost to follow up and then something untoward happens, right? I think that the communication is a big area where things can go sideways. And that's why I was sort of highlighting that through those hypotheticals.
Okay. Now, would you say that kind of a mistake can often weaken a dentist's defense?
Every case is unique. So I was using a general hypothetical. I wouldn't even call it necessarily a mistake. I mean, that's not typically how I view things. Like, did somebody make a mistake? Because again, remember, in legal parlance, and I am not a lawyer, that none of what I'm representing today should be construed for legal advice. I'm just taking it from the perspective as a clinician who does medical legal expert witness work. What I would say is, even what you said, well, a mistake. Did he make a mistake? Does that mean he did something, but he meant to do something else? Does that mean he did something and the result was not what he expected? So I'm not sure exactly. That's just my medical legal brain. I would say, what do you mean by mistake? I would say focus on delivering good patient care, fantastic patient care, amazing communication, and a lot of the legal and making sure your documentation is robust. And that, to me, I think takes care of a lot of situations. Usually when something untoward happens, there is one of the things you can see is that some of the documentation was, sometimes we say, thin, right? It's not terribly descriptive nor robust. It might be described as, generic in some instances, or copy and paste. And while, certain people do copy and paste things, did you truly capture what was going on with the patient? I think that typically people undercommunicate, and listen, that's not necessarily, that could be a symptom as well, right? If you're running a very busy practice, and you miss a communication in your inbox, or you're not able to get back to somebody, that could be a symptom of you're also very busy. That's something we see a lot in healthcare lawsuits these days, is providers are asked to care for and carry in the hospital a level of patients that is challenging. And can they process the amount of data they need to process? And by the way, I'm sure dentists do this as well. There are also layers, right? In healthcare these days, we're seeing nurse practitioners and physician assistants helping out a lot. And so is there what we would say a voltage drop in the communication of a physician assistant sees a patient, makes a decision, and that doesn't get relayed to the doctor, who might have made a slightly different decision ultimately. And based on the jurisdiction, they're actually in charge of this other healthcare provider, but that communication doesn't happen. And therefore, something goes unchecked, right?
I see. So in the dental world, it would be between the dentist and the hygienist. And if the dentist is working with other associates within the practice, and if you have multiple providers working on the same patient or providing care to the same patient, then yeah, I could see that. Having a treatment plan and coordinating it amongst all the providers so that there's no overlap.
And that's why documentation is important. Obviously, there's a billing component to it, and you obviously want to document what's there so that when you come back to that patient, you understand what's going on. But you're also communicating, as you pointed out, because you're working in teams. And so a lot of these lawsuits, they don't happen a month after you saw the patient. We're talking about, it can be years. So you're looking at notes from a couple years ago on a patient. It might have been a couple years since you saw them. And so how robust is the documentation on that issue in that patient? And so that's where a lot of the problem can come up. Is a lot of the providers like, listen, I don't even remember what I was thinking. All I can tell you is what I typically do and what I documented in this chart. So unfortunately, there can be situations where people are having sidebar conversations and not documenting it. And that in and of itself doesn't mean something nefarious is happening. I'm just saying that there are times where important information is being transmitted, and it might be worthwhile to document that.
Mm-hmm. That makes sense. Now, using technology for documentation and keeping in mind HIPAA compliance, what is allowed and what isn't allowed? Or more specifically, if there's some gray area, what would you recommend in those instances? What modes of communication to avoid?
I mean, I would try to keep it as simple as possible. I think in this day and age, there are, people use email, people use their cell phones, and they use their cell phones for calling. They use their cell phones for, sending text messages, and the hospital or the practice may have a closed loop, texting app that's HIPAA compliant. But all of that, keep in mind, all of that is what they call legally discoverable. And so if you're involved in a lawsuit and you say, hey, did you text with your patient? There are a lot of, concierge providers and I'm not saying it's wrong to text your patient, but all of those things are discoverable, meaning a opposing counsel can say, oh, you were texting with those other doctors, or like this patient, the OMFS consultant that you sent somebody to, you're friends with them. Yes. Do you know him? Yes. How well do you know him? I'm just pretending here that we're in a deposition and the attorney's asking you questions and you're involved in a lawsuit. They can ask you, oh, you text him? Yes. What number do you text him from? Who's your provider? Verizon. They can then legally go get your text messages and then see that you were texting with the provider. And just because it's not in air quotes medical record, your text messages about that individual are what they call discoverable. So I would say as best you can, and it doesn't mean it's inappropriate. You could be saying, hey, thanks for seeing the patient sooner. She, I was really worried about her, right? But anything you say can be entered, not anything, but there is a chance that it can be admitted. Again, I'm not a lawyer, but this is just based on my observations. They can ask for those things. And so I would say just keep it professional and keep it to as few channels as you possibly can, and route the conversations through the proper channels, but make sure those proper channels are monitored as well. For instance, and this is an example that I see sometimes happening in the hospital, is the doctor will say, listen, I would have done something if I was alerted. And then you look at the nursing documentation, there's a brief note, patient blood pressure, X over Y, Dr. Smith alerted, no new orders requested. And then you look at the paging record, right, from their secure messaging app, and you can see the message that she sent to him, right, and the timestamps on it. So you want to make sure that you're using these things in a clear way, but also know that what you say can be found and could be entered. The likelihood you're going to be sued, keep in mind, is still very low on any given interaction. And really what we're talking about is, how do you provide the best care? Should you be chatting about your patients through text message or through personal emails or this and that? Just route it back just get back to the highway, the normal channels as quickly as possible. Because also that's how your system should be set up, where multiple people are monitoring that typical channel of communication. If you start texting about a patient, your colleagues can't, versus in your EHR, your colleagues, I suspect, won't be able to see that communication, versus if it's in your chart portal or something along those lines.
That makes sense. Now, in your experience, what type of cases do you most commonly see these clinicians being involved in? Like failure to diagnose or procedural complications,
Yep.
anesthesia
Yeah,
issues,
those are great ones. Yeah, I mean, it's all obvious buckets, right? It's like, how do you think things could go sideways? It's a by the way, just because somebody has a procedural complication, if it's a known complication, like those things can come up. Now, the details of the case matter, but yes, it's a around the time of a procedure, care that was so big 50,000 foot view. It's care that was given and didn't go as planned, or there was some complication of it. There's care that should have been given, or surveillance or tests that should have been done but weren't. And then there's like communication. Then that subcategorizes into communication, testing, procedures, referrals, right? And then it's time delay between, time is another bucket. That did you discharge somebody too soon, or did you monitor them, but you didn't put them on, this is a hospital thing, they weren't on the appropriate deep vein thrombosis prophylaxis to prevent a DVT from happening. So there's a time component and a care component in that time component. So those are the larger buckets where you can see things, at least lawsuits being filed in terms of, did somebody breach the standard of care? That's a different conversation.
Now let's move on to high-risk scenarios in dentistry. Are there any particular procedures or patient scenarios that tend to carry higher legal risks?
It's a good question. I think that, there are certain specialties, as think of it this way, as compared to medicine, it's like if you're a internist or a family doc versus you're a neurosurgeon, right? As you're doing more high-risk surgeries, there's more risk and more margin of or less margin of error. And so, those, as you are doing more high-risk procedures, that's where you're more likely than not going to see the potential for more lawsuits. That being said, you could probably also tell your risk of lawsuits by how much you're paying comparatively to your colleagues for malpractice insurance, because the actuaries behind the insurance would know very well what your overall risk is. So as a bellwether to your risk compared to, OMFS to a dentist to an orthodontist, just looking simply at the insurance premiums is like my insurance premiums compared to OB, and obstetrics, somebody who delivers babies, right? It completely night and day. They probably pay 30 times what I would pay in terms of malpractice. So I would say look at the insurance premiums. And if you're just doing general, cleaning, yes, there are things that can go, there are ways to breach the standard of care, but the margin of error, I think, for certain individuals is just different as you move heavier into procedure-laden subspecialties.
Okay, that makes sense. Now we did talk a little bit about procedural complication. Let's say that happens with the dentist. What are the most important steps he or she should take immediately?
Well, I mean, take care of the patient. I think, I'm a simple, I've worked at some fancy institutions, but I like to think of myself as a fairly simple doc. You take care of the patient, you put in the orders, and then you document. But I think communication is a big part of it. So take care of the patient, communicate very clearly throughout the step. Treat the patient as you would want to be treated. I mean, I think that's very clear. There sometimes things do not go the way you would have hoped, and I think communicating that in an honest, open manner, without delay to the patient is paramount to excellent medical care. And then documenting your conversation, documenting what happened, documenting the subsequent care and your plan moving forward. I think that's very important. I think that not enough clinicians do that. And certainly, let me say it this way, the ones who, in hindsight, didn't do that certainly wish they would have.
That makes sense. Now let's talk about the other team members that typically the provider works with. How does liability extend to them? So the back office people like the hygienists, dental assistants, or the front office staff. Are there any systems that could be put in place by the practice to reduce exposure?
Again, it just comes down to timely communication. This is not legal advice, and I'm not a lawyer, but generally speaking, yeah, I hear what you're saying. Like healthcare is a team sport. How do you? And depending on the jurisdiction, there's something called captain of the ship. Some jurisdictions have laws around it where you're allowed to mention that, and others not so much. But essentially, you're in charge, right? So as the attending, as the individual in charge of the patient's care, all those other lieutenants and infantry members, to use the military analogy, are your responsibility. Good training, supervision, personal audits with data, I think is important. And I'm not sure enough practices actually do that level of introspection in terms of saying, how well are we doing with, following a patient when they go to, do we have tight communication? Like, yes, you have a patient portal, but what's your time to responding to messages? Do we have multiple ways that they can communicate with us? What's the after hour call communication, right? When somebody's on vacation, what happens? When we send somebody to another provider's office, they're kind of out of our realm and we can't control that, but we're still kind of responsible because I sent them to the OMFS specialist, and there's, it is a bit of a hot potato, but if that OMFS person recommends something else, is there any voltage drop when they make their own recommendations towards us? Like they tell the patient to get a CAT scan in 2 months and we're not able to effectuate that. So I think, again, that's why doing these legal reviews can be helpful, because you can look at other practices and see where things might have gone sideways. But I think it's just taking time out. I think that's a difficulty. Is a lot of people are very good at being on the treadmill and they don't take time to
That's right.
to look at their own practice and dealings with how they're doing things on a daily basis. The machine is very good at just cranking and moving forward, but sometimes you got to stop and look under the hood and make sure that what nothing's slipping through the cracks. Which I'm sure everybody could practice more efficiently, certainly.
That's right. And even if it's not daily, I recommend at least once a week. Have like something called a CEO day in your practice once a week, and then look into these things.
Yeah, and listen, there are obvious times where it sounds silly, but like there is a bucket of cases like where transitions matter. That's why I was talking about referring somebody out, because now you're not in control. Maybe if they're in your healthcare system and you can see things through the EHR, but I suspect one of the issues that dentists may have is, depending on how they're set up, they're kind of on an EHR island. And once the patient goes out of the system, they lose visibility, which to a clinician is very challenging, right? So now you have to transcribe the information to get it back into the system. And that can be problematic. But there is the point I was going to make was there is a time frame. I was just reviewing a case not that long ago, and I just even guessed it. I was having an initial call with the attorney, and he's like, "I'm not sure. Is it work? Do you think you would collect the records on this one?" And I said, "Let me guess." I was like, "Well, one of the things, I suspect the procedure was done." I'm like, "Let me guess. Was it a Friday?" And I just kind of said it flippantly, like as a joke. Sure enough, we looked up the date. It happened on a Friday. And so I suspect, I haven't seen the records, I wouldn't say I'm biased, but one bucket of problems that happens is in care transitions. Your practices on Fridays, it's like business hours at a postal service. Like people want to close the doors, right? And if you're open 9 to 5 and and you're watching somebody post procedure in your office, do you kind of push them out because it's a Friday, right? I will see what happened in this case, but that's what this attorney was concerned about. Like, did something untoward happen because of the time of day, the holidays, hospitals down staff, right? Does that play a role in any of it? The time of day, the time of year, the location that it was supposed to happen. In some instances, weather plays a role, So I think that those are sorts of things that people don't necessarily look at. And certainly in the dental practice, I would say, how does your practice not only or is communication an issue just while you're open, but how does your practice work and communicate with patients when you're, in air quotes, closed, right? Nights, weekends, holidays. That's very important because a lot of, and I've used the term a bunch, but a lot of voltage drop, meaning like important information does not make it from one person to another, happens nights, weekends, right? Holidays, where you might staff differently, right? And so I think that's another area where it's probably low-hanging fruit to look at your practice.
Yeah, no, that makes sense. And oftentimes, I feel like if the provider is the business owner who's also running, let's say it's a smaller practice, doesn't really have an office manager, they sometimes have trouble having other team members be there to provide that care after hours, or whether it be, on a day when the practice is typically closed.
There was a book by a surgeon. His name's Atul Gawande. It's called the Checklist Manifesto, I believe. What he did is he had another surgeon. He had been a surgeon for a while. He invited another senior surgeon, to come around and critique him, essentially. If you're a small provider, you're on an island. Like and I am certain you're a great clinician. You're very intelligent. But there was a French philosopher, Camus, Camus, who said the eye can't see itself. If you're a small provider, I'm sure you have a network. Invite a friend on a day off to just kind of come in and like evaluate your practice. I am sure there are consultants who will do it paid, right? But I'm certain that exists. But start with a friend. Hey, do you mind just coming looking at my systems and what I'm doing, or just asking them when you go to a conference or on the weekend? Hey, how do you handle weekend call? What EHR are you using? What are you doing for billing X, Y, or Z? How do you handle consultants on? I mean, I think the problem is a lot of times. Listen, I was at Mass General for 14 years. I feel like I blinked my eyes and that time went past. I am certain a lot of solo or small practice providers feel the same way. When was the last time you really looked under the hood to make sure things are working, to today's standards? And so ask a friend. Start there.
Okay, yeah, that's great. And a lot of our listeners, dentists, they oftentimes belong to study clubs. And this would be a great thing to bring up in your next meeting and see if you could have one of those people come by and take a look. Even if you don't have a colleague that might be willing to do it.
Yeah, or secret shop one another, right? Like, I'm not sure if it's harder to do that in medicine, right? But maybe in dentistry, if you're just going for, a cleaning, like, obviously it's hard because you can't make up a name. You have to represent who you are. But I think what you described with those study clubs, go for a field trip. Go for a field trip and go to somebody's office and look at the workflow, look at the patient flow, look at the EHR, look at somebody is going to see something that you don't see. And I think all of those opportunities raise the bar and raise the standard and help people perform to the best of their ability. And that serves your patients, and that ultimately improves their care and reduces the likelihood that you would be involved in a lawsuit in the future. It doesn't prevent it. I don't think there's anything that prevents it 100%, certainly. But I think, ask a friend. Absolutely.
It's at least a step in the right direction, I would say. Now, if you could implement one legal protection habit in every dental office tomorrow, what would it be?
Yeah, it's a good question. I would say it's to an individual practice. I think it's hard across all boards. I would say something along it probably has to deal with documentation, and timeliness of documentation and thoroughness of documentation. I think that's certainly one area where things can go sideways. I think the difficulty too with dentistry, we see this in medicine, but not, I feel like this is just one man's opinion. The number of dentists I've been to in my life compared to the number of of doctors I've been to in my life. Now I'm younger, but I've definitely been to more dentists. And so there are probably way more dental electronic health records than there are physician electronic health records. And so I think trying to standardize the documentation across providers and across the country, I think would be helpful. Because I think the difficulty is at times you're not dealing with full information, which can be challenging.
Okay. So in essence, basically put in systems to have the best form of documentation that's available in the market, whether it be utilizing technology or internal methods, just making sure it's HIPAA compliant and making sure it's standardized so that everybody, whether it's a new hire or an existing employee, they can all follow the same protocol.
Yeah, and I think the difficulty is you want to make sure that it's so that somebody else can pick up the patient and know exactly where. I think some of the EHRs are almost too complex, and so there's almost too much information, and that's where you lead to voltage drop. It's like there's so much, say you've been to 5 dentists and you've had all these procedures, and like, what's the plan now? What's going on now? Like you get inundated with data, and how do you find what you need to find and communicate what you need to communicate? And so I suspect I don't feel like I had the best answer for like what safety provision you could put in, but it has to deal with communication. Honestly, I suspect most practices, if you have to say something, it's something along the lines of improving and timely communication, whether that's communication of results that were done, communication of did you do what I said you should have done? Did you complete the antibiotics? Did you see that orthodontist? Did you get that imaging study that I needed done? Here's the imaging study results. So now you can go see OMFS. Did you call them? Should we call them? I think it's communication, because I think time delays and communication are 2 very big buckets in general that are low hanging fruit and easy to do.
Okay.
But by the way, what's easy to do is also easy not to do, right? Like I'm sure most of your listeners are going to be like, I communicate with all my patients, right? But the issue is that one important time with that one important thing I don't know if this is a real thing. I keep making up this like hypothetical referral to a OMFS specialist. You could probably give me a better hypothetical, but am I barking up the right tree with that or no?
No, you're fine. You're fine.
Okay, perfect. So, but I think that's like most people, what's easy to do is also easy not to do, right? And so I think that that's really what comes down to it, is like that one thing that's going to slip through the cracks. It's going to be like, oh, it's that one patient who needed, in my world, this isn't a case, but I'm just making this up. Like that one person needed a follow-up, a colonoscopy was recommended. It was, you told them to schedule it, but did you put in the referral order, but you didn't circle back. It got scheduled and then canceled. It wasn't redone, or they did it and they found something and they wanted a repeat colonoscopy. Did you get that information? It's that it's again, the things that are easy to do are also easy not to do. And so communication is certainly one of them. And most people, by the way, if you say, oh, are your communication systems tight? People, what's the saying? Nobody likes to say their kids are ugly, right? So another reason to have your study group come over and just say honestly, like, what's awful about my practice, right? And and by the way, that's opinion, but data is important as well. So it's like, what are the cancellations? What's the follow-up sequence to cancellations? On consultants, how is the information shared? How is on our test results? How do we know, we communicated to them? Well, you sent them a text message. Is that communication? It's not closed loop communication, because you don't know if they've received it. Now you could get a technologist to say, yes, their Verizon phone, it shows that somebody read the text message, but you don't know if your patient read the text message. So I'm not saying you have to go to their levels to this, but my point is you really should scrutinize your practice from a data standpoint, because it's truly objective. The subjective component's important as well, but I think from a objective component, the data will be there too, right? Like, I think they're going to be, and those are areas that are easy to identify.
Of course. Now, where can dentists connect with you or learn more about medical legal education?
Yeah, thank you. I really enjoy having conversations with physicians and clinicians all over the United States. You can look me up at medicalexpertwitness.com. There should be a button at the top that says book a call. I'd love to hear your story, hear what you're up to, and you can book a call and have access to my schedule there directly. There are no barriers there. And hopefully we can find a time. If for some reason you can't find a time, just put in a message. We might be able to accommodate a different time that isn't listed. But I love hearing from providers, whether it's a big group or a small group. And again, my expertise is in internal medicine and hospital medicine, but I spend my time helping individuals in the expert witness and medical legal space. I spend a small amount of my time doing that, but I've done it for long enough that I like to think someone who's worth having a listen to.
Perfect. All right. Well, it was a pleasure having you today, Dr. Romano, and thank you for sharing your knowledge with our listeners. I'm sure there was a lot that they learned from, and it was just a pure pleasure for me as well. I learned a lot too. Thank you.
Thanks for having me.
Thanks for listening today. Be sure to subscribe to Beyond by Wings on your favorite podcast platform. For more information, you can follow us on Facebook, Twitter, and LinkedIn, or reach out to us on our website. You can also shoot us an email at info@eandassociates.com.